name is Dr. Daniel Fox, and I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorder. And in this video, we're going to talk about borderline personality disorder and complex post-traumatic stress disorder. And as we go through this, we're going to identify the factors that are very similar of both, and then we're going to talk about treatment approaches as well. But let's talk about first about traumatic events. And most traumatic events, right, such as car accidents or national disasters, that those tend to be time limited. Now, what we're talking about here is we're talking about the individuals that experience this continuous trauma that repeats for months or years. Now, these individuals experience chronic trauma. Now, they report additional symptoms to formal PTSD symptoms. And what these are, a lot of times it's changes in self-concept and the way that they adapt to stressful events, okay? So complex PTSD can also be called disorders of extreme stress not otherwise specified. Now, it's used to describe the symptoms of long-term trauma, okay? And now research indicates, now this is what research shows, and it's very interesting, that 92% of individuals with complex PTSD also met criteria for formal PTSD. Okay? Now, complex PTSD was not added to the Diagnostic and Statistical Manual, the 5th edition, okay, in large part because of that you have the formal PTSD and then complex PTSD was on top of it, even though it's so similar. In the book, there's a lot of different disorders that it couldn't include all of those, and it did not include complex PTSD. But let's talk about complex PTSD. And typically complex PTSD tends to come out of, or individuals experience it, those that have been in concentration camps, those that are prisoner of war, prostitution brothels, individuals that have experienced long-term domestic violence, long-term childhood physical and sexual abuse, as well as organized exploitation rings. You see that these kids come out with a lot of complex PTSD features as well. And what happens is that an individual who experienced a prolonged period of chronic victimization and total control by another person, okay, that they also experience these difficulties we're going to talk about now. And as we go through it, what I want you to ask yourself is, is this similar to individuals who also have borderline personality disorder or borderline personality disorder traits? Okay, and the first one is emotional dysregulation. And we're going to define this as persistent sadness, suicidal thoughts, explosive anger, or repressed anger. And this is a component of complex PTSD. Okay? So emotional dysregulation. Individuals with borderline personality disorder often experience that. They often have these experiences. And then there's difficulties of consciousness. Okay? And that's forgetting traumatic events, reliving the traumatic events, having episodes in which the individual feels detached from their body. They can be experiences of dissociation, which we do know it can also be common in individuals that have borderline personality disorder. I actually did a video on dissociation and borderline personality disorder, if you're interested in checking that out. And then there's also difficulties of self-perception. And difficulties of self-perception, this entails a sense of helplessness, shame, guilt, stigma, right, and a sense of being completely different for everyone else. And this is something that I hear a lot in my clients that have borderline personality disorder, is that they experience these things. They feel different than everybody else. Everybody else is human, and they're this odd human out. Okay? So that's also very similar to individuals with borderline personality disorder. Now, the next one is disordered perceptions of the perpetrator or the victimizer. Okay? And you attribute total power to the victimizer. Okay? And you become preoccupied with the relationship to the victimizer. This is, when am I going to see him or her? When are we going to have contact? How long is that contact? How can I manage it? How can I adjust it? Okay? So there's that fixation on the relationship. And it's also a preoccupation with revenge, a lot of revenge fantasies. A lot of my clients that have experienced chronic trauma, childhood trauma, they have a lot of revenge fantasies in regards to their abuser. Okay. Now, another factor, right, of chronic PTSD is difficulties with relations to others. Now, this is isolation, distrust, or repeated search for a rescuer, trying to find this one individual. And sometimes folks go to mental health providers and thinking, well, you have to have the answer. You must have all the answers. And we're going to talk about treatment in a little bit and different treatment options that you can have. And I'll try to give you some suggestions on how to find treatment that might help you out. Okay, so difficulties with relations to others. And the last one that we're going to talk about, this is difficulties with one's system of meaning. Okay? And this can be a loss of sense of faith or belief in the order of the world or how the world functions, or a sense of this continuous hopelessness and despair. Okay, so these different factors, well, there's a lot of overlap, right, between borderline personality disorder and complex PTSD. And a lot of individuals that are diagnosed with complex personality disorder, right, that certainly they've experienced long-term trauma, right, as we defined it just a moment ago. But individuals with borderline personality disorder, a lot of them have histories of physical and sexual abuse, psychological abuse, neglect, hostile conflict in their home growing up, early parental loss in childhood. And that loss doesn't necessarily mean that it's the death of the caregiver or the parent. What it is that sometimes the parent got involved with drugs, got involved with a romantic relationship and started to neglect the child and stopped paying attention to the child, things of that nature. So we see, right, we know that individuals with borderline personality disorder and the features that we just talked about, that there's all that overlap. What do we do about it, right? How do we discern between the two? Well, the problem becomes is that many mental health providers, I think, have difficulty discerning between the two. Now, if we are not working on that distinction, and I just mentioned all of those different criteria, and I didn't say complex PTSD, would you think, oh, well, that's borderline personality disorder? Well, you may. And it's important to discern between the two, because we don't want to misdiagnose an individual, because what happens is, right, diagnosis helps us with trajectories and directions for treatment. Okay, so it's important that we know what we're dealing with. A misdiagnosis, that can sometimes lead us off in a direction, and we can kill a lot of valuable time, and we certainly don't want to do that. Treatment time is valuable time. Okay, so it's important to understand whether characteristics of chronic PTSD, or if the individual has a personality disorder, or if they're occurring together. Okay, so it's important to do that. And here's some things to consider, to think about if you're a mental health provider, or if you're working with a mental health provider. These are some things to be aware of. So let's talk about treatment. Now, when we talk about treating complex PTSD, right, that this often involves addressing the interpersonal difficulties, right, and the specific symptoms that we just talked about just a minute ago. Okay, and what we want to do is, if you've seen my other videos, you know that my approach entails looking at surface content, right? And these are all those expressive behaviors and symptoms. But what drives them? It's that core content. What is underneath? And a lot of trauma, what can happen is that can impact core content and how that person sees the world and what motivates them in the way that they behave with the world around them. So it's really important to discern between the two and what we're working with. But I think that if you're an individual who does meet that criteria for complex PTSD and borderline personality disorder, or one or the other, I think it's important to have that conversation with your mental health provider and say, well, which one do you think impacts me most? What are some of those things, and you can work with your mental health provider to work this out. What are some of those things that's driving these behaviors that are causing me all these problems and difficulties with my relationships and how I see myself and my emotional regulation and all these other factors that we talked about. Okay? And it's working on those issues. Now, there is an individual, her name is Dr. Judith Herman, and she's brilliant. She wrote a book. It's called Trauma and Recovery. It's wonderful. I give it to all of my students to read, to go through it, and I think she has such a great conceptualization of how to work through trauma, and for all of us, a really compassionate way to look at it. And we're going to talk a little bit about it here, because when she talks about complex PTSD, she says that what this requires is a restoration of control and power of the traumatized individual. And if you know from my other videos that my approach has empowerment weaved all the way through it, encouragement, an Adlerian component, also called encouragement, is that I like to encourage my clients, empower my clients to make the change and have better control over themselves. And what her approach is, and what we're talking about here, is that survivors can become empowered by healing relationships, which create safety. And that can be a mental health relationship, right, that can help you as well. It allows for remembrance and mourning, about mourning for that experience, recognizing that past experience and working past it or coming to terms with it as best you can, and promote a reconnection with the life around you. Is learning, going from maladaptive skills that were disruptive, right, and patterns that were disruptive, to adaptive and healthy patterns that are helpful for you, that move you forward. Okay? So there's several effective treatments for complex post-traumatic stress disorder, and these are also effective with borderline personality disorder as well. So there's CBT, and that's cognitive behavior therapy. And in a nutshell, what cognitive behavior therapy is focusing on relationships, thoughts, feelings, and behaviors. Typically in this type of treatment, what you do is you target current problems and symptoms, and you focus on changing patterns of behaviors, thoughts, and feelings that lead to difficulties in functioning. Okay. There's also what's called cognitive processing therapy. And these are things that you can Google, and you can look for a mental health provider who specializes in these areas related to complex PTSD and personality disorders, or one or the other. And cognitive processing therapy, or CPT. Now, this is a specific type of cognitive behavioral therapy that helps patients, or helps individuals, learn how to modify and challenge unhelpful beliefs related to the trauma, okay, how to reprocess it. There's also interpersonal therapy. In my therapy, in my work, I do a lot of interpersonal therapy, also another type of treatment called object relations, so I do that as well. But in interpersonal therapy, now this is a lot of times, so it's a time-limited approach, and it focuses on interpersonal issues. Okay, and you try to understand those issues to be a factor of the development and maintenance of that psychological distress. So how is that system, that interpersonal system, okay, how does that factor into that individual's maladaptive beliefs, behaviors, and patterns, and how is it's reinforced? And a lot of targets for interpersonal therapy that seem to be symptom resolution. You want to improve interpersonal functioning, and you want to increase that social support for that individual. Okay. And then lastly, there's something called prolonged exposure. And prolonged exposure, this is a specific type of cognitive behavioral therapy, another one, that teaches individuals to gradually approach those trauma-related memories, feelings, and situations. Okay. It's by facing what has been avoided. Okay. And a person presumably learns that the trauma-related memories and cues are not dangerous and not to be avoided. So it's exposure to these memories that you have and these different experiences, and over time you see through that exposure that the impact and the intensity of those memories that they tend to lessen as well. And there's a lot of research that supports the efficacy of prolonged exposure. But it is important to do that with a skilled mental health provider who knows how to do this treatment. It's important to do that. I hope that you found this video useful, and there is a lot of help and support out there for folks that have, whether it is complex post-traumatic stress disorder or borderline personality disorder, or both, right? Whether they're comorbid together. It's important to find treatment, and there is a lot of good treatment out there, and it can really help you to make a difference in your life and to be more successful in order to get the things that are important to you. So I really appreciate your time. Thank you very much. If you enjoyed the video, please subscribe to my channel, and please have any comments that you may have. And thank you very much for your time. I appreciate it. Bye-bye.